The medical profession has become an extension of Big Pharma, and rather than fixing problems or even preventing them, we're trained to push as many pills as possible. Joining me now to talk about this problem is Dr. Tom Schneider, board certified and experienced in so many parts of medicine. Dr. Schneider, I want to talk about your book a little bit because it's such a powerful indictment of the FDA. What caused you to write it, first of all? You've been in the medical profession for so long, certified in this, certified in that, years and years and years of experience. What was it that drove you to say, I've got to write a book and expose the problem here?
Yeah, that's a key question, and actually I have to compliment you because very few people have ever asked me that. It really came across to me, Mike, by my own experience. So when I give a talk, if there are 100 people in the room, I usually start by saying, I want to know what your wellness is. What does that mean? It's everywhere. You can buy wellness apples and wellness toothpaste and wellness spas. And I said, let me get a feel for you. Raise your hand, just raise it, if you've had heart disease, been 100 pounds overweight, high cholesterol, diabetes, insulin, lost your kidneys, perforated bowel, heart disease, bypass. Well, this gets on and on and on and gets old. And I said, let me stop and say, who out here in the audience has had every one of those disasters, every one of them, and you're still alive today and you're happy to be here, you want to live tomorrow? Oh, one person has their hand up. And they all look around. I go, no. You're looking right here, right here.
Well,
I'm the guy.
Let me ask you this, Dr. Schneider. Yes. As I read your book, the startling thing to me that most people don't get is they believe that the FDA is there to protect them. They believe that somebody is looking out for them. In fact, interestingly enough, if you were to ask 10 people, 9 of them would think that the FDA actually does the testing on drugs themselves, don't they?
Exactly.
So
true,
you turn all that on its head. How about doing that here? Tell the viewers what the real relationship is and how dangerous the FDA has become.
Well, and again, let's keep it at a level. Let me try to keep it at a level that patients, me, understand. And that is, you've just heard all of the disasters that I've had, and some were related to Agent Orange. I ejected in Vietnam during the Vietnam War, and certainly Agent Orange, a toxic agent supplied by the government, did devastating damage to me. However, most of the other problems that I mentioned, the diabetes, the perforated bowel, the heart disease, came from medications that I was taking. Medications, Michael, that I was taking. 10 months ago, we delayed this show because I was in an ICU for 4 months because I was taking an injectable synthetic type of insulin that causes pancreatitis. It ate my pancreas, my liver. I spent 4.5 months in an ICU.
Okay,
now,
so you're getting to the so the question is, why do you write this? Somebody who goes through that, it's kind of a wake-up call, I suppose, and you say somebody's got to talk about it.
Oh, yeah.
As you approach this topic, though, I noticed your discussion about something as basic as statins. Everybody now, you go to the doctor, your cholesterol is 3 points high. Oh, my God, you've got to have a statin. And the discussion then with the doctor is, well, you say, well, what are the problems? The doctor has been told that there are very few problems. The doctor has been sold the idea that a statin is so important and imperative to survival. Well, now, you talk about your take on that, for example, and not just your take, but a whole body of doctors that are saying this is nothing but a sales job by the drug industry. Talk to me about that.
Sure. So statins, I don't downgrade all of medications. I still take some. Some people actually benefit from statins, but the percentage is about 15%. So out of 100 prescriptions written for a statin, 15 are for people with congestive heart failure, inflammatory disease, and they're probably helpful. Maybe not any better than Motrin or aspirin, but they're anti-inflammatory. The 85 other prescriptions that have been written are pretty much dictated by very attractive pharmaceutical reps, no offense to the males that are out there as well, by the FDA and by Big Pharma. They have pushed that if you're not on this, you're going to die. I've had heart disease, bypass, stents, everything imaginable to my heart for a lot of other reasons. I'm not on a statin.
Okay, let me ask you something. Every time when there's an alternative kind of solution to it, for example, there are alternative issues that not just you talk about, but plenty of doctors, medical doctors for years have been talking about. Before statins were out there, they would advise the client, the patient, to do A, B, and C. And then all of a sudden, statin comes along. It's the new cash cow for the drug industry. So as the cash cow comes onto play, all these other things are forgotten. What are some basic things that you would advise patients of when you were coming up through the process of being a doctor?
Right. So they need to know some of the actual facts. You know, it's kind of that for doctors, for everybody in America, you're entitled to your own opinion, but not your own facts. Unfortunately, beliefs and faiths supersede facts. They often do. So when you go to see your physician and he says, Michael, your cholesterol is 220. You need to be on a statin. The question should be, what are the side effects? The answers would be increased risk of diabetes, breast cancer, prostate cancer, and definitely 80% cognitive delay. We haven't even talked about the muscle ache problem that everybody knows about. Those are big, big issues from taking a statin. Is it going to make me live longer? No. We have no evidence that it's going to make you live longer whatsoever. It is going to cause you lots of side effects. Now, so my issue then is for this whole aspect of statins is it's a tremendous, I think it's I could be wrong on this, don't hold me, but it is, certainly was 3 years ago, the largest prescribed medication in the United States. Just
okay. Now look, without just focusing on statins, SSRI. Your book says the same problem with SSRI. Obviously, you were talking about the dangers of Vioxx before it killed thousands and thousands of people. What I thought was so interesting about your book, Doctor, was that the things that you talk about in that book are a frontal attack to the system of the creation and distribution of drugs. And one thing you talk about is that the FDA gets 40 to 50% of its money from the drug industry. Now talk about that, because it's insane. It's almost like Colonel Sanders guarding the chicken house, isn't it?
Right. It's exactly right. It's a perfect analogy, because that's precisely what the FDA does. The FDA is in a position where it deals with Big Pharma, and you know that Big Pharma is an $800 billion plus industry a year. $800 billion. And the FDA is a humongous part of it. They were supposed to be the watch guards, the keepers, the safeguards of medications. It has turned into a who has the most money, who has the newest medicines. And here's the bad part, Mike. And when I say this, it always sounds like I'm on a diatribe. Oh, you're against the government. No, I'm not. And medications are good. You know, what I do want people to understand are the facts. And those facts apply to things like statins, like SSRIs, all of them. Their side effects are humongous, and they are given money. The FDA is given money. Physicians are given money to improve the statistics that they work better.
Okay, so what we have now, when you talk about the government in your book, you're very specific. You talk about Daniel Troy, for example, who is nothing more than a mutt for the government. He was the mutt that came in on behalf of the drug industry. Nobody put together the fact that he was squarely working for the industry. His entire career had worked for the industry, and now he's continuing to work for the industry. But while he was there, he was head of the FDA, and he allowed at least 12 drugs. This is the real number, because as you know, we handle these cases. 12 of the drugs that we handle directly from a standpoint of having to sue the manufacturer, 12 of those drugs caused injuries that were so bad that they were permanently debilitating. They would cause death. I could go on forever about Daniel Troy, but Daniel Troy was one of the mutt bureaucrats that came out of the FDA because he was bought and paid for by the industry. Did I get that right?
Correct, and he went back into the pharmaceutical industry when he left the FDA. He went back to Big Pharma. And the difficulty is that this is not let's downgrade Mr. Troy because it's over with. This is an ongoing today issue. Today, as this show airs, the same process is happening. The same debilitating effects are happening. I am a walking example of the side effects of medications. And it's very, very difficult to get across to individuals. There are alternatives. You mentioned statins. Can red yeast rice with minimal side effects be used? Of course it can. Almost all of my patients were placed on red yeast rice, not on statins, those who needed it. But getting that out there against an army, a wall of misinformation, is unbelievably difficult because I look like the radical. I look like the...
No, I tell you, the point is this: when people read your book, and let me just tell you, I read books constantly because that's my job, to be informed. Your book is excellent, and being an insider and having to confront the FDA and the drug industry constantly, I can attest to the fact that you got it right. People should buy this book, they should understand the book, and they should be willing to fight back by doing some of the things that you talk about in that book. Tom Schneider, Dr. Tom Schneider, thank you very much for joining me.
Thank you, Michael. What a pleasure. What a pleasure.